Good morning. My name is Dr. Ken Anderson, and today we're at the Anderson Center for Hair. I wanted to review with the viewers what a patient would look like, or in fact does look like, 12 days following an ARTAS robotic hair transplant procedure. This is our patient Bob, and we performed a robotic procedure on him 12 days ago. He stopped in for pictures, so we're going to have a little bit of a closer look at his scalp, where the grafts were taken from and where they were placed. So I'm going to come around and take the camera and have a look at that. So Bob, you could say something. Actually, don't say anything. Bob wishes to remain anonymous, so I'm just going to talk for him. We're here in the dissection room, so there's a microscope in front of him, but this is not where Bob typically sits during the day. He's just in for pictures. The grafts were taken from the back and sides of his head. The hair has grown out at this point to more or less cover a great deal of the areas that were previously harvested. And as you can see, Bob has a generous amount of hair loss, and he was pretty much hair free on top. At this point, however, he's got a little bit of crusting left. A little bit of crusting. And Bob, you can put some baby oil on there and let that soak for 30 minutes, then hop in the shower and rub those grafts pretty good with your fingertips, finger pads, and that should all come right off. Just having a look over the grafted areas. So he's got a new hairline in here, as you can see. He's got we also addressed his bridge, and then I created a posterior hairline for him. He'll have a tiny spot in the back, but that's a normal pattern that is found in nature. Of course, one of the major advantages of the robotic transplant procedure that performs follicular unit extraction is that there is no linear scarring whatsoever. Typically, at 12 days, a patient would have their stitches taken out, and there'd be a wound more or less from ear to ear in the same general area as these grafts were taken from. But of course, we did the ARTAS robotic hair transplant surgery, which is follicular unit extraction. We extract one single hair at a time. So of course, there is no scalpel used. There is no linear scarring. There is no stitches to be removed. And so in the future, Bob can wear his hair as short as he likes, because there really is no linear scarring to worry about. We achieved excellent density through the front. And in 9 to 12 months, Bob is going to have a lot more hair across the top and through the frontal hairline than he had before, which was more or less none. And that's with the reframing of his face that's really going to make a major difference in his look, and will probably take 10 to 15 years off of his appearance. We here at the Anderson Center for Hair perform robotic surgeries more or less every single weekday. And consultations are complimentary. Give us a call if you'd like to have some more hair and no linear scarring. It's what I specialize in every day. We're here at the Anderson Center for Hair. My name is Dr. Ken Anderson. Thank you very much for watching.